NCD civil society is coming together in Kigali, Rwanda to exchange knowledge, share good practice, and strengthen capacity to advocate for prevention and control of NCDs. The forum will provide the platform to strategize, coordinate, and unite ahead of the UN high-level meeting on NCDs in 2025 to ensure it brings about a meaningful change for people living with NCDs. The forum is possible thanks to our strategic partnerships and will be convened together with Rwanda NCD Alliance in collaboration with the Rwanda Ministry of Health and Rwanda Biomedical Center. Thanks to our supporters who have contributed to making the Global NCD Alliance Forum a reality.
Ladies and gentlemen, good afternoon. Good afternoon. Good afternoon. I want us to give a big hand of appreciation to the Minister from Rwanda for the great achievements Rwanda is making on NCDs. It is so refreshing to know that those things we know work are actually being implemented in Rwanda, because the NCD problem is one of known knowns. Not known unknowns and known knowns, it's known knowns. You know what to do to make the progress. And when you see a country that's actually taking the steps to make that progress, you must appreciate it. So welcome to the opening plenary of the Global NCD Alliance. My name is Dr. Githinji Gitahi. I'm your moderator for a really fantastic panel here. And this time, this particular forum is being held in a continent that for very long, as Minister Butera said, did not believe, or rather believed that NCDs are for the rich and old. But we know they're not. We know they're here, and the numbers are clear. But we are only holding it here again because Rwanda has a fantastic conference center, none other in Africa. Please, a big hand for Rwanda. Please, we take it for granted. We are only here because there's a fantastic conference center in sub-Saharan Africa, probably in South Africa, Egypt, but this remains the premier convening here. And in fact, 2 weeks from now, we'll be holding the Africa Health Agenda International Conference right here in partnership with your ministry. So thank you to the government of Rwanda for allowing us to be able to convene such a fantastic venue. Now, I don't have to go through all the statistics, but I just want to say, and the panel will frame this better than I, that the problem of NCDs and the rise of NCD mobility and mortality is going to challenge the Agenda 2063 of Africa. It is going to challenge the achievement of Agenda 2063 of a peaceful and prosperous continent. It's going to challenge health systems and risk collapsing them. I keep saying that what's going to collapse health systems is not communicable diseases. It is non-communicable diseases. It is, therefore, of continental socio-economic value to have this conversation. In our continent, families are paying for this problem. 80% of all NCDs, as has been said many times, are funded out of pocket by families selling their cows and everything else. The communicable diseases have been lucky to date because significant part of communicable diseases, HIV, TB, malaria, have actually been taken care of by our development partners. But who needs to be told that actually that is slowly slipping away? Not slowly anymore, actually, rapidly, with what is going on with the US government change in policy. And that's not only US government. I've seen the same announcements with the Dutch government, Germany, and the entire movement in Europe. So communicable diseases are also going to face a similar challenge, which means that the space, the little dollars we have for NCDs are likely going to be channeled away to cover the gaps in communicable diseases. So this is the problem that we have to discuss and say, what is it Africa can do to solve this problem? not only to mop the floor through care and treatment, but to stop the tap from dripping. Because if we don't stop the tap, we will never keep up with mopping the floor. So I want to invite our excellent panelists to come and discuss this further and tell us what kind of acceleration do we need ahead of the UN high-level meeting in September, but even beyond that, to national country plans, national action to ensure that this problem is navigated and resolved adequately. So allow me now to invite Leah Kilenga, founder and CEO, Africa Sickle Cell Organization. Leah, please come up. Leah is also a CNN Hero 2024 for her work in sickle cell, in ending sickle cell challenges. Mary Efua Kome, Program Manager for NCDs, Ghana Health Service. Mary, please join me. Kumivi Agboyibor, Technical Officer Non-Communicable Diseases at WHO Afro. Professor Mambo Muvunyi, he is the Director General, Rwanda Biomedical Center. He'll be telling us a little more about what Minister Butera has talked about and how that success has been achieved. And last but not least, Mr. Itete Karagire. He's a monitoring and evaluation expert at EAC Secretariat, and he'll be talking to us about regional collaboration. Welcome. So let's just go straight to this because we don't have a lot of time. I think we just have 40 minutes for this conversation, so we'll not take too much time. And I will request my panelists to keep it brief and sweet. Let's first start to navigate the problem, where the challenges are. So my question for this is, hearing what has been said at the opening ceremony, knowing what you know because you've been in this space, we know there have been progress. Rwanda has highlighted quite significant progress. We know globally we have made progress on tobacco cessation. We have made progress in some countries on HPV vaccination to end cervical cancer. So there are successes to be celebrated, but challenges are significant because even within the NCD targets, we really haven't had people who have actually met the targets as they were. So we'll come to ask what the challenges are. Is it financing, infrastructure, policy, and what action do we need? But before we go to that question, we have a video from our Director General of Africa Centers for Disease Control and Prevention. Let us hear Dr. Jean Kaseya.
Distinguished leaders, colleagues, and dear friends, I would love to be with you in Rwanda today, but as you know, we have the AU Assembly, and today we have the Executive Council. It's a great honor for me to address you today at the Global NCD Alliance Forum in Kigali, the fourth of its kind in Africa, under the theme Leadership on NCDs toward 2025 and beyond. Non-communicable diseases remain one of the greatest health and economic challenges for our time. In 2019, NCDs accounted for 71% of global mortality, many of which are preventable. Africa is undergoing a rapid epidemiological transition, and by 2030, NCDs are projected to become the leading cause of mortality and morbidity in our African continent, surpassing communicable, maternal, neonatal, and nutritional diseases. Despite these alarming projections, financing for NCDs remains inadequate. In 2022, less than 3% of global health financing were allocated towards NCDs in Africa. This is despite the fact that NCDs account for nearly 37% of deaths in our region, a figure that will continue to climb. This discrepancy underscores a crucial gap in our health financing priorities. If we are to safeguard the health of our people, we must shift our focus and ensure that NCDs receive the attention and resources they deserve. As we approach the 2025 UN high-level meeting on NCDs and mental health, Africa must seize this opportunity to shape a bold, ambitious, and action-oriented political declaration on NCD toward 2050. At Africa CDC, we are committed to advancing multi-sectoral action and coordination to address NCDs, injuries, and mental health in alignment with the Agenda 2063. Through the implementation of our 2023-2027 strategic plan, we are supporting policy reforms and strengthening governance for NCD prevention and control. We are strengthening primary health care as the foundation for human care and universal health coverage. And we are driving multi-sectoral collaboration at both national and continental levels. But urgent and bold action is needed. Please let me call upon all of our member states, all of our leaders, our partners and our stakeholders in Africa and beyond to reinforce political, financial, and technical commitment to NCD, prevention, and control through a multi-sectoral approach aligned with global and regional health frameworks.
Excellent. A big hand for DG from Africa CDC. And we now transition to this panel. Leah, let's start with you. So what do you see? Where are we not making progress in a significant program of work in ensuring that we can save these lives that we are talking about? Where are the hurdles? Are they policy, financing? What exactly are they? And what are you doing within your work to address them?
So yesterday, Daktari, my suspicions were proven correct that more than 60% of the cost, of the NCD cost, is not borne by government or philanthropy or industry or private partners. It's borne by out-of-pocket expenses. So the cabbages, the cows, the lands that we own as people living with non-communicable diseases and communities affected by NCDs, we are experiencing catastrophic out-of-pocket expenditures. And now with the existing climate and disruptions that we're having, I'm afraid that we are going to have a larger percentage, more than the 60% that we're experiencing. And if you're very keen or with what the introducers and the opening plenary and the different speakers have alluded to, this 60% plus is commensurate to the mortalities that we are seeing in sub-Saharan Africa. So, but we already know that some non-communicable diseases have already been bearing these burdens, especially those that are neglected, like sickle cell disease. So we are just catching up when everyone is now experiencing the tightness that we are all in this forum realizing of the current situation. So what are we doing? So I will speak to sickle cell because we have been jogging behind our big brothers and big sisters in sub-Saharan Africa. But I'm happy that Dr. Gina introduced 3 things that they were doing. And I wanted to highlight and shine a spotlight on the Pen Plus. This is looking at integrating healthcare delivery, especially for these under-prioritized non-communicable diseases. These NCDs that have been left from the conversation or from the big rooms. So they have been able to look at healthcare delivery, especially strengthening rural health systems and ensuring that no one is left behind, especially for pertinent NCDs like sickle cell disease, type 1 diabetes, and rheumatic heart disease that are pertinent for sub-Saharan Africa. But with Gina, I think she hasn't really unpacked it clearly. As much as we are seeing successes and it is being implemented in more than 10 African countries, they're still having a risk. Because if they are the only ones, if the governments are the only ones who are looking at this particular framework or financing this particular, it's a risk for them. So there's this other part. Now we are looking at integrated approaches of health financing. So I am also seated within the World Coalition of Sickle Cell Disease, where we have the pharma industry, the Novos, the Novartises, the Pfizers, we have the WHO, we have ASH, we have these partners who have been doing things by their own, in their own spaces, coming together and looking at sickle cell and asking, how can we have a different approach? Looking at whatever is existing within sub-Saharan Africa like PEN+, how can we feed onto that, but pooling our resources to a more system, community, and person-focused approaches. So that is what I think is happening within sickle cell, because we cannot afford to be left behind, and we cannot afford to allow this cost to be borne by people like myself.
People-centered, community-led, integrated.
Yes.
Otherwise, I hear from you. And I saw Dr. Kome was looking at you and disagreeing with the 60%, because earlier she told me in Ghana, it is 80% of NCDs are out of pocket. I'll let that battle between the two of you behind the tent later. For now, let me come to Professor Muvunyi. This same question, because the successes of Rwanda have been significant. But again, one of the things I find interesting in Rwanda with this progress is that actually the mortality rate percentage from NCDs is significantly high. It could be that if you look at the absolute numbers, it could also be, Mr. Butera, that because of your successes in managing communicable diseases, therefore you're not having as much mortality in communicable diseases, and therefore the high percentage of NCD may actually give the view that they are higher, but it's because of the balance between communicable. I don't know, I'm just guessing. So what challenges do you still have, even with these successes? And what is it you like to talk about how you're addressing this and the role of who you're collaborating with?
Thank you very much, moderator. I think, first of all, I think I'd like to welcome again our guest to Rwanda. I think Rwanda Biomedical Center, through the Ministry of Health, we are really honored to host such a very important meetings where I think more discussions are going to be come out of this conference. And also, I want to probably to say that I think my minister has said most of the things that I was supposed to say, but again, that again brings another challenge that you can see. To respond to the questions, moderator, I think we may have a very good policy and guideline, but also good strategies at national level. But again, if you consider some of the challenges that Rwanda has gone through into making sure that we translate those policies into implementations, I think there is such disconnections between what policy which are available and the readiness of institutions, the people, the sector, the fundings, and also the community to really make sure that we are on the same line in terms of really making sure that if today, for example, the health benefit package is improved by including some of the additional NCD services. But how are we ready in making sure that we are at the same time implementing that policy? So I think there's a disconnection between the policy and also the implementations, which I think is, for me, one of the major challenges that's myself heading institutions which has the mandate of implementing all those policies. So again, if you want to go into specific details, I think one of the major problems today is that, again, if you consider health system, I think our health system probably are still disease-specific, based in the way they are designed, in the way they are operating. So again, most of the speakers have really said that we need probably to integrate the way we want to continue to implement. So again, health facilities are not ready in terms of really making sure that we have facilities which are closer to the community, but also accessible in terms of available high quality NCD services in addition to the other services. Second, I think if you consider Africa, I think we are probably facing many priorities. And I think most of the people here have mentioned about communicable diseases. I think our priorities are more shifted around communicable diseases. And we have received many supports, which I think probably has, again, pushed us to really continue to focus on HIV, TB, malaria, without leveraging on that opportunity to also include NCD as additional services. Again, this is one of the things probably, again, explaining why there is delay, there is disconnection between policy and implementations. Second, if you consider still healthcare system, I think as of today, the shortage of skilled and qualified healthcare professionals, I think probably are not yet prepared to really implement those NCD interventions, NCD services. And so if we go beyond health system, I think, again, most of our services are more strengthened around curative services. We've mentioned that prevention is also a key if you want to really tackle NCD threat. So again, there are some things that probably are there that make us not ready to really implement on right time those changes in the policies. And today, we are saying that NCD is today a problem. But again, I'm sure that this problem is going to be more as our population are growing, as our population are aging. So again, we are still not yet prepared in terms of those policies and also the system around to facilitate the implementation of the policies. Last but not least, I think if we see the context of Africa, as an implementing agency, we are facing issue into translating policy into community engagement. I think community, if without community, I think you may probably not be able to really improve the services. One example, for example, I can tell is that we have a very good services around cervical cancer screening. But if you ask how many women have been able to really be screened either once in a year. So we found probably the services are available, but the health-seeking behavior, I think is probably something that we need probably to also bring in another way of really implementing those policies, but really understanding what are the needs, what are the demands, and what is the capacity of the communities in terms of also adhering to those policies, but also seeking those care in terms of NCD. Of course, moderator could elaborate more, but again, I don't have time to say it, but those are the main challenges in terms of really making sure that we really are ready for implementing those policies, but also addressing the issue of NCD. Thank you.
Thank you. Thank you very much, Professor. And I know when I hear from Rwanda saying there's a mismatch sometimes between policy and implementation, I don't know how many of you have noticed that Rwanda is probably one of the only countries here where people, motorbike riders, actually wait for the lights to turn green before they move forward. Meaning the policy is fully implemented, yeah? So can you imagine countries where nobody obeys the lights? The mismatch in NCD policy and implementation is actually bigger than yours. So let me come to you, Dr. Komevi, because you have had the PEN Plus being talked about. WHO is a norms and standards organization. Most of these guidelines are done out of your technical depth research. But now you're hearing here there is also that mismatch between when you have the recipe, you need the person who has the culinary skills to convert it into a meal. So where is this gap? What are you finding across the continent in terms of the mismatch between policy and implementation, and what other gaps, financing, whatever, that might be contributing to this? Over to you. Your mic is not on, sorry. Okay, try again.
Hello?
Thank you, good.
Great, thank you so much. So firstly, I wanted to appreciate the NCD Alliance and the Rwanda NCD Alliance, and also our host country, the government of Rwanda, for inviting us. You know, speaking to NCDs in Africa, especially today, ahead of the 2025 UN high level on NCDs, I think is critical. Firstly, for us to, you know, access our progress, and then second, to define the path forward. So coming to the challenges to implement NCDs or improve access to NCD prevention and care within our region. We have here the good examples, for example, from Rwanda. We have other examples. When it comes to decentralizing NCD services, we can give example from Benin, for example, where you have a strong commitment from the government to scale up the WHO PEN package into all primary health care facilities. So when you go to those facilities, you get screened, you get your treatment for hypertension, for diabetes. And we also hear about the PEN Plus, so moving, you know, above the common NCDs and looking at the severe NCDs. So this is showing us that it's possible, it's feasible, you know, to reduce NCD burden, to make sure that services are available from policy level to access to care. Now, what is hindering like the access to care in some of the country? In my view, I think the first thing will be political engagement. Countries where we can see successes are countries where you see a strong involvement of the government. So willingness to fund more NCDs, to adopt, endorse policies that can reduce NCD preventions and risk factors. And then, secondly, I will also mention the emphasis on primary health care. You know, we know in our country, our region, more than 65% of communities are living in rural and remote areas where access to care is challenging, where we have a shortage in human resources, specialized healthcare providers. So there is a need to train people to make sure that we are able to do task sharing, task shifting, to make access to care available at the lowest level of care. Okay. And then thirdly, there is also a need to empower civil society and people living with NCDs. Because having a long life condition, you need a mentoring and a way to work with the community so that access to care is not only happening at facility level, but it's started at community level through awareness, through education for both prevention, but also linked to care. So those are some of the challenges we can mention. Thank you.
So maybe I could move on from those challenges, ask you, before I come back to Dr. Kome, are there any success stories? One success story that you've seen from a WHO Afro point of view that is worth looking at to scale across the continent of Africa out of these conversations?
Thank you so much. So I think WHO Afro has endorsed in 2017 a regional framework for integrating NCD services into primary health care level. And the framework was endorsed by all our 47 member states. And since then, WHO has worked with various partners to start its implementation through the WHO PEN and HEART package. Up to date, we have 36 countries within our region which are implementing the PEN package at primary health care level at different stages. You have countries,
I think that's, so we are moving.
And you can see part of those countries, some of them have 100 coverage, like Benin, and some of them are moving over 60% of coverage, like Rwanda, like Malawi. And we also have other countries that are willing to engage. And one of the key steps when we receive a communication from a country that like we wanted to start implementing the PEN package is a formal communication from the minister saying we wanted WHO to support the pilot, but we are engaging in scaling up the implementation. So I think it's the same process for PEN Plus. We can say today 20 countries under the support. We are working together with the Hemsley Charitable Trust, the NCDI Poverty Network, and 20 countries have been implementing the PEN Plus. We know Rwanda is quietly advanced with over 40 facilities implementing the PEN Plus. Malawi is also one of the key implementer. So we do have quite a number of key successes that countries can learn. And maybe the other point before stopping is how do we make sure countries can learn from each other? Yeah. Not only in terms of access to care or service provision, but on other areas like access to medicine, for example. How do we move to pool procurement and strengthen the 6 building blocks when it comes to NCD prevention and control?
Thank you very much, Komevi. And I'm hearing one is a full implementation of the existing tool, because that's available, and where it's been implemented, success is clear. But secondly, where it's a success, there needs to be inter and intra-country learning. I think that's a key one. And the question is, how does this forum, and even as we move to the UN high-level meeting, how do we create platforms for inter-country learning? Yeah. So, Dr. Kome, maybe I would like to first ask about WHO, the PEN package. How is that going in Ghana? And is it a success story for you in Ghana? And if not a success story, it's okay to tell us. So what success story would you like to highlight in the Ghana landscape on NCDs under the Ghana National Service? Over to you.
Okay, thank you very much. So for us in Ghana, the stories that we would like to share, I would want to label them as strategic partnerships.
Okay.
Strategic partnerships because for NCDs, we cannot do things as usual. When we were seeing our dancers this morning, I was just smiling because I was looking at the deliberateness, the intentionality, and yet the forcefulness. They came in with a lot of grace, a lot of finesse, but they were very forceful. And for us to make any progress at all in the NCD front, we are talking about integration, but we need to be intentional with this integration. There are multiple leveraging opportunities within the health system that we can take advantage of. For us in Ghana, we realize that one of the things that has worked for us, indeed with the support of partners, has been establishing a robust mechanism for NCD prevention and control. Without the political visibility, without having that sense of national direction, it becomes difficult for the poor community health worker to decide on her own that, well, since I have a blood pressure monitoring device, and if I'm attending to a woman providing reproductive health care services, automatically I should include blood pressure monitoring. So you need that sense of national direction in order to be able to have an impact at the service delivery point. Beyond that, for us, the partnerships has also helped us to ensure that even with the revision of our policies, NCD policy, NCD strategy, we have been able to engage both local and international partners, patient groups, and I'll come to patient groups very shortly, who have supported us to develop patient-centered and relevant policies. Original policies were there, however, the actual impact that we were hoping to see was not much. But transitioning and this time engaging a wider stakeholder audience, now you make very relevant impact. We've been working with PATH using what we call the NCD Navigator that maps out key partners both at the local and the national levels. And for these key partners, we identify the roles they are playing in the NCD field, which NCDs they are addressing. Within that NCD prevention and control spectrum, what specifically you are doing. And it would be interesting to know that initially, most of the activities were targeted around the policy bits, awareness creation, and very little on service delivery, which is what would ultimately benefit your patients. Yeah. So we had to go back and engage these partners that you are doing so much. You are creating awareness, which is very well appreciated. However, there's more that needs to be done. And when the platform is shown, you see right there that something like palliative care and rehabilitation, you can't even find any partners working in that space. So how is the care going to be holistic if in this spectrum of service provision you don't have partners in that field? I would briefly like to talk about some of the initiatives in country that has worked so well for them. And these have come up largely because of co-creation. We had an activity we undertook in one of our teaching hospitals that we call CREATE, and it involved self-management of diabetes, for instance, and the patients themselves are brought to the table and the packages of care are developed with the client. So it's very customized based on what your needs are. And we realized that diabetes control shot up from the initial around 13% within that facility to about 63%. Just because now the patients were preferring solutions that worked for them. In my home, this is what I can afford. What can you help me do with this? And clients are better able to comply once they are that much involved in their care. I dare say that for NCDs, this is a lifelong condition. We cannot treat it just as we treat communicable diseases, where worst case scenarios, day 5, day 7, you are done with your antihypertensive. And the health system is literally done with you. We need to develop strategies that would ensure that at the barest or most minimum cost, the client is self-regulating. They are dictating what would work for them. Developing the policies are good, and our minister just mentioned that implementation.
Yes.
It doesn't matter the number of documents we have on the table. If at the end of the day, the document development is not linked to the implementation on the ground, virtually we are not going to have any solutions done. So for us in the country, those are some of the initiatives that are helping us.
Thank you. Thank you very much, Dr. Coleman. Yeah, please. Big hand there. I had partnership. I had you also extend the conversation that was brought by Dr. Komevi about government leadership. And you can see that where there is success, there is government leadership. I see my teacher, Dr. Eva, here. And when we were being brought up and we were being trained in school, there was this thing called the diabetic diet. I don't know whether we are still doing it. No, we are not? Okay. So tailor-make the solution to the patient. Yeah? Eva Jenga, thanks, and good to see you there. She heads our NCD Alliance in Kenya. So tailor-make to the patient. So back to what Leah was saying, it's patient-centered and community-led, but then supported holistically in enabling environment by government leadership. So this is what I'm hearing over and over. Now, let me come to Dr. Karagire, Mr. Karagire. I'm hearing a lot of this collaboration, country learning, all those things, case studies. You sit at the EAC. I know you're doing an EAC framework for NCDs. Does it capture these things to address these challenges? And also, at the same time, you can answer, I'm hearing community has been very central to areas of success. In development of this framework, how much of civil society engagement was done, or what was the contribution of civil society? You could answer both together. Over to you.
Yes, thank you very much, Dr. Gitai. First of all, thank you for the invitation to participate in the meeting. And I will start by, it's not bad to repeat, even in our region, and also to share with our delegates that the East Africa, we have in the East Africa 8 countries. So for the NCD framework, I will start by saying that the rising prevalence of NCDs in our region present a major public health challenges, and also it places immense pressure on health systems. But we remain committed as a region to support the community. That is why, before going straight to the framework, we have developed other documents, which are also very important to share with you. The first one is the EAC Health Sector Investment Priority. This framework, it's a 10 years framework. And then one of the priority, it was to establish Center of Excellence, Regional Center of Excellence. And then we have 4 centers of excellence which are responding to NCDs. They are fully operational. We have 1 in Tanzania, which is the Cardiovascular Science Center of Excellence. We have 1 in Uganda, also contributing, which is Oncology and Cancer Center of Excellence. We have 1 in Kenya on neurology and nephrology, which is also fully operational. We have 1 in Burundi, nutritional science. But we have also 2 cost-cutting here in Rwanda, biomedical engineering, and also the vaccine immunization and supply chain. So all these centers of excellence are there to support NCDs. They are operational, they are building capacity, also providing specialized services. So now let's talk about our framework, this NCD framework. I can tell you it's the first one. In all the recs we have in the African Union, we have different recs, but the EAC is the first one to have a specific NCD framework. And then this framework, it was done through a very consultative and collaborative process where the Secretariat with government experts, here I'm talking about NCD program managers, and the civil society through, now I'm talking about other stakeholders. Civil society was also engaged, and then a special thanks to the East African NCD Alliance because they've been there providing not only financial support, but also technical support. That is why we have a very good framework. It's always easy to produce frameworks because we have many frameworks, but now to translate it into action, that is the most difficult part. We all know that. So we have a very good framework. I can even share the objectives, which I think it's important to share. We have 5 objectives. The first one is promote public awareness and community engagement. Here you can see that civil society can play a very key role in this objective. Also, we want to improve access to comprehensive services, both primary and specialized, and then to strengthen data surveillance, to strengthen leadership, and then to strengthen domestic and innovative financing. We have a very clear framework. Under all these objectives, we have key strategies, strategic interventions. It's very nice. But again, we need to translate all this into action. So the framework is there. It's very good. So now let's see how we can mobilize resources. This was also one of the directives for our ministers last year. Yes, we have a good document. Now, please mobilize resources and start implementing the framework. I think that's all I can say. Thank you.
Thank you. Thank you very much for that. Yep. Let's appreciate the contribution. And I have a question for you, Mr. Karagire. In that framework, because I would imagine that the framework borrows from the knowns. You know, there is the PEN, there are the global strategy for NCD, there is SDG, so all that. But I would imagine that as an EAC framework, it will be very useful for finding ways of encouraging tariffs within the countries, because then those can be driven by intergovernmental bodies like the EAC. Are tariffs a part of this framework? Sugar tariffs, alcohol tariffs, or not?
You can go into the document.
Yes.
We have shared everything. So now it's up to us.
Yes.
Since a regional framework, we have all the governments involved. Okay. So we are proposing different approach and very clear strategic interventions which can help our community to move forward.
Okay.
So they are there. Thank you.
Good. Thank you very much. So, Prof, do you have any one or singular success story in Rwanda that you like to share that can be replicated across the other countries in Africa as we talk about country learning? One success story you're able to share?
Thank you very much. I think this is we have many very nice success stories to say, but I'll pick some few of them. And those success stories are guided by 3 principles. One is that I think for Rwanda, those achievements are mostly due to a very high level of country ownership and also political commitment where there is accountability system from the top until the lower down. This is one of the things that probably is something need to be in place to allow all the interventions to be available and also accessible to the population. Second is that I mentioned about community engagement. Yeah. I think this is very important if you want to deal with the healthcare interventions. So communities, at all levels of communities, they are part of the solutions. They are part of the discussions on how to really improve their life. And those communities are most of the time on the top of any decision at the level of national level. So communities really put at the forefront of any decisions that the government, but also the institution are taking into the implementation. Last but not least, I think we have had a very special way of addressing some of the issues in financing. Two things. First is that, for example, I don't know if you know the way Rwanda Biomedical Center is organized. So it's an institution that implements all the health programs. More than, I think in 2011, we didn't have any program specifically dealing with NCDs. Yeah. We had HIV, TB, malaria. But since 2011, we had RBC established with a new division called Divisions in Charge of Non-Communicable Diseases. So I think this is something probably has been the result of how we have been able to really achieve many of the things. Second, nowadays we have implemented many things, and we are now challenged by how do we sustain our achievement, our gain, based on the current issues on financing, on climate change, on anything. So we had also a new division called Research Data Innovations. I think this, again, is another opportunity to really understand very well how do we implement with the low resources that you have by targeting those gaps and also those interventions which are going to make a very huge impact in terms of really improving the life of the community. So again, those are the things probably we need to continue to leverage on. And in addition to that also, this specific way of doing partnership, I think we have really been able, in addition to put all those services, medicines on health benefit, we have also been able to really have a specific partnership with private sectors, where, for example, today, there's a very specific discussion with Sanofi, with all those manufacturers to really probably get the right medicines at the right price to allow access to the community to this. So that, again, those are the areas which I think allow us to, again, have accountability from the high level, but also decentralizing, integrating all our interventions into one specific unit to allow proper resource use, but also probably also continue to probably ensure that there is sustainability in the healthcare interventions. Thank you very much.
Thank you. Thank you very much. And I think there are many things there, even back which have been talked about here, but community still keeps coming and government leadership keeps coming. And on this community question, we always ask, so who is the community? The communities are then represented by civil society, because communities are groups of common interests. And now those common interests then, because not every individual can show their voice, the civil society then raises their voice, not uses its voice, raises the voices layer, isn't it, of the community. So what is it that you think that communities through civil society, communities through civil society have been able to achieve so far in this area of NCD?
Thank you.
Mike?
Okay, yeah. Thank you. Yes, so civil society, I think you are a champion of the right to health, is the biggest instrument to realizing this right to health and also upholding this right to health by empowering communities and their voices. So I feel like civil society for non-communicable disease has shined these past 5 years, very tumultuous times. I would like to recognize the efforts of the African Non-Communicable Disease Network. Last forum in Sharjah, we realized, based on the representation of Africa NCD alliances, there were some countries that were underrepresented, and there were some countries that had no resources, or they had no this container of NCD advocacy. Yeah. So a group of young lads brought the African delegates together in a side table. Shout out to Ferdinand, to create the first bones of the African Non-Communicable Disease Network. And this network was instrumental in leading and also coordinating the regional NCD efforts, supporting East Africa, West Africa, South Africa, as well as ensuring that the countries that do not have NCD bodies to coalesce around NCD action have those action. So within those 5 years, within the pandemic, I think they have been very instrumental, because civil society needs to operate at multiple levels. So the ANN operates at the regional level, that is the Africa level. Of course, we have the NCD Alliance at the global level. We also have the regional alliances and the national alliances. But I think in some countries in sub-Saharan Africa have gone further to the sub-national level, where we have county alliances or representation. So during the COVID pandemic, I think they were instrumental. These particular multi-level actions was very instrumental, especially in getting the voices of those who are in last mile areas, where I also come from, to be represented in these conversations that people were having, like yourself, Dr. Gidinji, in these global platforms, virtually, where we need internet and electricity, and some of us could not have that. It was a luxury. But that representation, because the network is so spread out very deeply and very widely, we were able to have that, tested the robustness of what exactly meaningful involvement meant. And COVID tested that, and we were successful in pushing a lot of the NCD actions. I know a lot of people are saying we have not made progress, but that is one of the biggest progress that we have made. And going further, aside from the ANN championing meaningful involvement, we are seeing, I want to shout out to Guy, Maya, and this GCM, the global coordinating mechanism of NCDs in creating the framework of operationalization of meaningful involvement. Like a lot of, like that word is, I must say, quite technical. So this framework shows us the how, the whom, and the what of meaningful involvement. Good. So how do we, in a dignified manner, have people like myself in such platforms without severe expenditure on their part, and also for them to be able to articulate the issues that and the communities that they represent? Yeah. I think that was, like, that is the biggest win, in my opinion, for this past 5 years, and that is the power of civil society and the work that is going on in Africa.
Thank you, Leah. Thank you so much. And today, I managed to go to the plenary where civil society was planning for the UN high-level meeting. Yes. And a big shout out to civil society that are here, and especially the local civil society organizations. Great work. And thank you, Leah, for bringing that up. So maybe come to Dr. Comment to say, you've listened to Leah. She is civil society. Governments don't always like civil society sometimes. But you sound like, from what you're saying, that you have actually a very good link with civil society in Ghana. So could you comment on this in 1 or 2 minutes? Like, how are you seeing civil society helping to shape government policy and action?
Absolutely. For us, I mean, we see civil society to be a very crucial element in ensuring that NCD prevention and control is moved forward. Dr. Arora put it perfectly, that health systems are not wired to appropriately respond to NCDs. Yes. So in order for us to change the narrative, it cannot be business as usual, and that's where civil society comes in. From the advocacy bit, even with respect to the technical house. civil society has a crucial role to play. For instance, in some of our technical working groups, you do have civil society representation as well as specific patient group representation, and it makes all the difference. Governments cannot do it all.
Yeah.
And I dare say that as we strive to move forward with NCD prevention and control, the health system structures have been set up. So there are multiple leveraging points that we can take advantage of. But in order for us to be able to make that meaningful impact, we need to ensure that civil society is at the center of it all, in terms of driving patients and creating that demand for the services, in terms of creating awareness in the availability of the service and the need for the patient to even access the service. Yeah. In terms of even the NCD financing bill that we are talking about, multiple risk factors we are seeking to address tend to lie outside of the health sector. Yeah. And as we are looking at roping in, so one of my key challenges with NCD is that we continue to present it as a health sector problem, whilst the drivers largely lie outside. Yeah. So civil society's role now comes in mobilizing all these the players outside the health sector to come into the fold to realize their relevance and the key roles that they can play to ensure that we can together build the system upwards. NCD financing, we cannot continue to rely on the system and have our 80 to 60% being borne out of pocket. Yeah. Ultimately, that is even going to be a disservice, and the patients are going to seek for alternatives.
Yeah. Exactly.
Which is what they are doing.
Yeah.
You cannot be blind to this fact. So I see civil society playing a role, but having a much higher stake in ensuring that NCDs are more strongly addressed in Africa. Let us not rely on the routine systems to do things business as usual. Let us change the narrative, and that can be fully supported by civil society.
Excellent, because civil society is who covers the first mile, which is the last mile, actually. Thank you very much. So, as we come to an end of this conversation, I would like to hear from each one of you. You know, when I listen to the civil society in the morning, they're very ready to drive that the UN high-level meeting and make sure that the agenda that we're talking about here, country agenda, is on the table. But I feel often, I have been involved in multiple high-level meetings, UHC and others. And I think this is what, Prof was saying earlier, that when those things are done and the declarations are signed and the celebrations are over, what changes at country level will remain the only important thing that ever happened out of that declaration. So I'm hoping that with this movement of society here, driving a positive declaration at the UN high-level meeting, that there will be an effort to take that out and now go back to the national, subnational, and all the way down to make sure that those declarations turn into action, and this policy to implementation gap is left, supporting governments, pushing them as you do to ensure that happens. So let us close with a 30-second from each person to just ask one question. The UN high-level meeting is coming. Give me one thing you don't see in that declaration. One, and just 30 seconds for each. I'm going to start, from my find.
Mike, thank you, moderator. I think for me, it's just to move beyond rhetoric, to translate our frameworks into clear actions, and also the health financing, the financing part of it. Okay. And then here we insist on domestic funding.
Good. Thank you. So action and domestic financing needs to be considered in the UN high-level meeting.
Thank you, Mike. I would say we need also to keep in mind that we should move beyond the common NCDs. In Africa, we do have a high burden of chronic and severe NCDs, sickle cell, type 1 diabetic, congenital and rheumatic heart diseases. Definitely, those conditions needed to be part of the discussion. Second, NCDs cannot be managed in isolation. There is a need to work together, both government, international partners, civil societies, and people living with NCDs together. And it's time to move from discussion to concrete action and make sure that we are able to deliver concrete results.
Good. So all-inclusive and collaboration as a key part of the framework. Thank you very much. Dr. Kome.
Okay, so for my end, I would seek that we are deliberate and intentional in addressing NCDs. I would even only pick NCD financing.
NCD
That as a
financing.
continent, how deliberate are we in ensuring that our NCD strategies, NCD activities are financed, and we need to target specific NCDs to ensure that they are controlled. So the deliberateness is what I would seek, and the intentionality to ensure that NCDs are financed. That, for me, I will be very grateful if at the end of the UN high-level meeting, we can state that the continent has taken this bold decision, and at the end of the day, this is how much we are spending on our NCDs, and it has led to these results.
Good. So deliberate financing, led domestically and whichever other resources we can get, which then means that, and you want action that we can follow, which means that now for the civil society, ensure your countries can report to the voluntary national reports on these conditions. Then, Professor.
Thank you very much. I think, for me, I think we don't want to see declarations become aspirations. It has to be reality. And for me, I think we need probably to say, how do we bring also the current landscape in terms of using data? It has to be driven by data for good actions, but also making sure that those decisions and financials has to be guided by this data, so that probably Minister of Finance understand very well what do we need to, how do we need to improve, to invest in this as an investment than a cost for those declaration recommendations. So data-driven, but also current innovations, technology need to be part of those resolutions, so that we make quick result, but also anticipating what is ahead as NCD burden. Thank you.
Thank you. Data, technology, and innovation, critical. That then helps us to make data-driven decisions at country level. Finally, Leah.
Finally, so this is the first year that sickle cell is going to have a declaration in partnership with UNICEF and the World Coalition of Sickle Cell Disease. So I will not speak to that, but I want to speak to the plenary. So I know we are in a tenuous period of existence in terms of development, but I want to remind you that NCDs are deep, they are long, they are hard, and they move beyond the man-made lines and silos and definitions of pandemics, climate change, policy, politics, financial changes. And I want to remind you that the only constant, even you, maybe this is just a job, or this is an opportunity, you're coming here for the first time. CEOs change, but the only constant that remains the same is the people. You cannot move communities, you cannot move people living with NCDs. Yeah. So what I want you, as we are going towards the UN high-level meeting and beyond, invest in people, people like myself, to think clearly, to speak clearly, to lead this action on NCDs. When we are leading to a UN high-level meeting and beyond, because people will be there, come what may. And if we are not investing in these people to understand the landscape of NCDs and the changing nuances and articulating these nuances to decision makers who come and go, we will not move forward. So I ask, even though you're paying for us to be here, to be present here, which is a great thing that you're doing, NCD Alliance. Like, all people living with NCDs that are here are supported to be here. Yeah. But go above and beyond and resource us with capabilities and capacities to be fully present and represent the communities that we are leaving behind. Thank you very much.
Excellent. Thank you so much. And I think that's a really good place to, please, let's stand up. That's a really good place to end this conversation with these panelists. It's been fantastic, and take this forward, and don't forget the action plan for the UN high-level meeting make sure it goes all the way and make this a political agenda. I now thank our panelists. I'll let them go off the stage except Ms. Aitete. We have one item to tackle. So please, thank you very much. A big hand for our panelists. Excellent conversation. So I would now like to request the following people to join me here on stage for the launch of the East Africa Community Framework. Honorable Minister of State, Dr. Butera, please join Ms. Aitete here. Professor Joseph Mushumbitsi, Dr. Kaushik Ramaiya, Par Kalestrap, President Danish NCD Alliance, Dr. Gladwell Gadesha, Acting Head of Division of Non-Communicable Diseases in Kenya, and Bent Latrup Nielsen, Head of Global Advocacy, World Diabetes Foundation. I have been your moderator, Dr. Githinji Gitahi, Group CEO, Amref Health Africa, and I look forward to seeing all of you here 2 weeks from now, 3rd to 5th, for the Africa Health Agenda International Conference that will actually be addressing social and ecological determinants of health, which is largely affecting the NCD community. Thank you very much. Over to the photographer. Oh, I'm told.